Alright, so we're going to do a general medical exam today with our patient Victoria here. And so what we're going to go through is we're going to do blood pressure, we're going to do temperature, pulse, respirations. We're also going to examine the ear using an otoscope and using a test called Weber's. And then we're going to evaluate the throat, and we're going to check her lymph node system as well as just the back of her throat with a tongue depressor. So we'll just go through them one at a time. So the first one is blood pressure. What we're going to use our cuff here on the wall. And when taking blood pressure, what you need to know is you're going to be recording the first and second carotid cough sounds of the heart. That's the first sound representing the systolic pressure and the second sound representing diastolic pressure. When you place the cuff on your patient, you want their palm to be up in the air, okay, and bringing the brachial artery to the edge. And you're going to place your cuff so that the artery index marker is running along the medial border of the arm. So once you get it placed nice and snug, you're also going to have your stethoscope ready, and you're going to place the earbuds anteriorly so you can hear better. You're going to place the large end of the stethoscope, make sure that's working right over the brachial artery. You're going to tighten your clamp, and you're going to pump it to about 160 and 180 depending on your patient, and you're going to release it about 2 millimeters of mercury per second and listen for both the carotid cough sounds. Alright, so here we go. Alright, so I got 116/62. Normal parameters being 120/80. So she's perfectly fine here in these readings. Alright, so after that, what we're going to do is we're going to take her temperature. So what we have here in the Myers building is a Welch-Allyn temperature gauge. What I would do is I would place this in here, grab one of the plastic probes, pull it out, place it underneath her tongue, and it would automatically take the temperature for me. I wouldn't want to waste any of our probes here, so I'll explain it to you. Her temperature should be right about 98.6, which is the normal temperature. Alright? So after we take her temperature, next thing is we're going to take her pulse and her respirations. So when taking pulse and respirations, normally you wouldn't tell your patient this, but for the video sake we will. When taking it, what we want to do is tell the patient that we're going to take their pulse only, and we're going to record it for 1 minute. All the time though, in that minute, the first 30 seconds, we're actually going to be counting respirations using our peripheral vision so that they don't alter their breathing in any way. Okay? So, and then the second 30 seconds, you will actually record the pulse. And each number that you get, you're going to multiply by 2 to represent the full minute, and that'll be your parameter. So, here we go. I have a radial pulse, and I'm going to count for 1 minute, okay? So go ahead and just read normally. Alright, so For her respirations in the first 30 seconds, I counted 8 breaths, multiplying that by 2 for a total of 16 breaths per minute. The average is 12 to 20 breaths per minute, so she's perfectly average here. And then for her radial pulse, I counted it 26 times. So if I multiply that by 2, we get a total of 52 beats per minute, and the average is 60 to 100 beats per minute, so she's just below normal, but perfectly fine. Alright, so blood pressure, temp, pulse, and respirations are over with. Now what we're going to go over is the examination of her ear. And so what we're going to do for that is use an otoscope, which we have here. Alright, so how this works, we just turn it on, gives you a little light, and you can adjust it with the flicker of your fingers. So, whichever side you want to test, that is the side you want to hold as well. What I mean by that is, if we're testing her right ear, I want to hold the scope with my right hand. That way, I can grab the upper edge of her ear, and we're going to pull it superiorly and posteriorly, and that way it'll open up the auditory external canal. And so what we're going to do is we're going to slightly gently place it in here, alright, and we're going to turn it towards the nose. Alright. Then what you're looking for inside is for the tympanic membrane. What you want to look for is a bluish, grayish, translucent kind of vision of the tympanic membrane, telling you it's healthy. If you see brownish or yellowish colors, that's unhealthy for it. Could be an infection. Also, if you see a closed canal bilaterally compared to the other side, then that could be otitis externa, which is inflammation of the ear canal there. Also an infection of some sort. And also, when you're examining ear, the other test that we can perform is Weber's test. So this is just checking hearing and making sure that both sides are listening correctly, in a layman's term. So how this test works is you're going to hit your tuning fork, it's vibrating, you place it on the base of their skull, and ask them if they can hear it on both sides, one side, or none. Alright, so are you ready? Mm-hmm. Here we go. Can you hear that?
Yes.
On both sides, one side or none. Okay? So she can hear it on both, which is a sign of being normal. And if they can only hear on one side or none, that is a sign. That is a positive for Weber's test. Alright, and so now we're going to move to the throat, and how we're going to examine that is 2 ways. We're going to examine her lymph nodes in the throat, checking the submandibular lymph nodes as well as the anterior cervical lymph nodes. So submandibular is exactly where they say they are, underneath the mandible. And to check lymph nodes, you're just going to gently run your fingers along underneath the mandible and feeling for any hardness, swelling, or also visualizing if there's any abnormal swelling bilaterally. And then the anterior cervical lymph nodes are posterior to the sternocleidomastoid muscle. So you just run your fingers right here in between the front of the neck, up and down, superior to inferior, feeling for the same signs. Redness, you want to feel for tension, swelling, anything like that. Alright? And then the last part of our exam includes the examination of the throat from the inside. So how we're going to do it, we're going to take a tongue depressor, going to have her open her mouth, we're going to depress the tongue and look towards the back of the throat. Alright? And what we want to use is a light. And now we can see towards the back of the throat. And we're going to have them say ah, which opens up the canal and makes you gives you a better vision. And you're looking for redness, swelling, you're looking for white spots indicating strep throat, things like that. So that is the exam for the throat, and you just dispose of anything that you have. And that is it. That is the entire general medical exam. Thank you for watching.